In today's health headlines, the first fatal case of something called Alaska pox has been reported. Could a spring COVID booster be in your future? And what to know about the recent listeria outbreak from certain packaged foods. Joining me is Dr. Albert Shaw, Yale Medicine infectious disease specialist and professor of medicine at Yale. Welcome.
Thanks for having me.
Alrighty, a man has died after being diagnosed with Alaska pox, a rare virus that mostly infects small animals. Is this something to worry about?
Yeah, I think the risk is confined to folks in Alaska right now. It's gotten a lot of attention. And so I don't think there's a healthcare provider that has seen this outside of Alaska. I only know what I've read in early journal reports. So this is caused by a virus in the same family as Mpox, formerly known as monkeypox, causes skin lesions. As you mentioned, seems to have animal hosts in small mammals. The first fatality that was reported was in an older individual who had a weakened immune system from cancer chemotherapy. There's been some speculation that the increased climate temperature in Alaska have led to kind of mushrooming in the populations of these small animals, voles and shrews that are apparently the host for this virus. But right now, it's something that is confined to Alaska residents, particularly those with animal exposures.
All right. A spring COVID booster may be recommended for certain groups of people. Who might be involved in this?
Yeah, I think the discussion is really going to be focused on folks that have the highest risks for severe outcomes from COVID because of advanced age, because of chronic medical conditions like diabetes or chronic heart, lung, kidney, liver disease, or those with weakened immune systems from cancer, chemotherapy, or other immune suppressing agents. You know, we know that immunity against getting COVID probably wanes after 4 to 6 months. And so it might not be prudent for those at the highest risk to wait until, for example, the fall for a new booster. So I think this is going to be discussed at the CDC Advisory Committee on Immunization Practices meeting, which is occurring at the end of the month. So we'll see what recommendations emerge from then.
All right, we'll know more later. And certain packaged foods have been associated with the current listeria outbreak. What do you know about that?
Yeah, so listeria is a foodborne bacterial illness. It can cause typical food poisoning symptoms, fever, nausea, vomiting, diarrhea, but can be really quite serious and even life-threatening in older adults, those with weakened immune systems from medications, including cancer chemotherapy, and also pregnant women and their babies. So right now, there's a multi-state outbreak that's associated with a specific manufacturer, and in particular with specific cheese products, either cotija cheese or ricotta cheese. And, you know, we haven't had cases reported in Connecticut yet, but products where these products show up, like in salad kits that have been sold in Connecticut, apparently at, Walmart, Trader Joe's, Costco, as well as ricotta cheese products sold at Whole Foods, have been sold in Connecticut. So it's something to watch out for. You can do a web search on listeria outbreak, and it'll take you to the FDA website that has a long list of the recalled products.
All right, Dr. Albert Shaw, thanks so much for being with us today.
Thanks again for having me.